evening, and thank you for joining us for The Digital Divide, What Families Should Know, brought to you by the Benjamin Rose Institute on Aging Young Professional Council. My name is Jennifer Cardellini, and I'm the Director for Consumer Information at Benjamin Rose and the co-chair of the Young Professional Council Programs Committee. This evening's webinar will be recorded. The recording will be available on the Benjamin Rose website, www.benrose.org, on the event registration page and in our resource library following the event. We also will be sharing a link to the recording with you in an email in the next couple of days. Please feel free to share the recording with colleagues, family, and friends who could not join us this evening. The changes brought by the COVID-19 pandemic to how we work, socialize, take care of our health, and go about our daily lives have deepened the digital divide. The gap between those who can use and have access to technology and those who don't. For older adults with increased healthcare and caregiving needs, as well as higher risks for social isolation, this divide can be especially daunting. In this webinar, we will look into what the digital divide is and what caregiving, healthcare, isolation prevention, and home care resources exist to help older adults and their caregivers navigate it together. We have a lot of information to cover in the next hour, so we will hold questions until after all of our speakers have presented. However, we do encourage you to submit your questions at any time using the control panel marked Q&A on the right-hand side of your screen. Now I will pass it over to Sarah Finch, co-chair of the Young Professional Council Programs Committee, who will introduce each of our speakers. Sarah?
Thanks, Jenny. Welcome, everyone. My name is Sarah Finch, and I'm the co-chair of the Young Professional Council Programs Committee. Thank you for joining us for the first Young Professional Council event of the year. Before we get started, I would like to introduce Dr. Catherine Bryan, who will share with you just a bit about the Benjamin Rose Young Professional Council. Katie is a financial planner and the Director of Training and Development at Skylight Financial Group. She serves as a member of the Benjamin Rose Institute on Aging Board of Directors, is the chair of the Institutional Advancement Committee, and president of the Young Professional Council. Please welcome Katie.
Thank you, Sarah, and thank you all for joining us today. And I'm so glad that we are doing our first program. Although it's virtual, it's still a great program for everybody, and it's about the digital divide. For those of you who don't know us, we are the Benjamin Rose Young Professional Council, and we are a group of young leaders in the greater Cleveland community who are passionate about the mission for the Benjamin Rose Institute on Aging. And we really support caregivers and empower all people to age well. We're really trying to promote that, to encourage philanthropy, networking, leadership opportunities, and really engage young people to have conversation about aging and aging well. And so for more information about the Young Professional Council, please visit us at www.benrose.org/YPC. And I'll take it back over to you, Sarah. Thanks.
Thank you, Katie. I'm introducing our first speaker this evening, Rachel Slomovitz. Ms. Slomovitz is a financial empowerment coach at Empowering and Strengthening Ohio's People, known as ESOP. ESOP is a HUD-approved housing and financial counseling agency and a subsidiary of Benjamin Rose Institute on Aging. Ms. Slomovitz has counseled over 5,000 homeowners needing assistance with foreclosure prevention. She's a HUD-certified counselor and holds several certifications in financial coaching and counseling, including from the National Community Coalition, NeighborWorks, Credit Builders Alliance, the Consumer Financial Protection Bureau, and more. She's also an Ohio Benefits Bank counselor, an adult vision screener, a volunteer income tax preparer, and has served as one of the first lead counselors on an innovative property tax loan program for older adults. Ms. Slomovitz is also a member of the Cuyahoga County Adult Protective Collaborative that focuses on issues relating to older abuse and exploitation. Please join me in welcoming Rachel Slomovitz.
Thank you, Sarah, and thank you to the Young Professional Council for having me here tonight. My name is Rachel Slomovitz, and I'm a financial empowerment coach at ESOP. Next slide, please. So I wanted to start off my presentation with a cartoon that I thought was so perfect for tonight. It's both funny and it's so true. It says, "It was bad enough when the grandkids knew more about technology than me." It's funny with the dog holding the iPad. I mean, even babies know how to use tablets and computers. I swear my nephew had to have been probably younger than a year old when he started using an iPad. However, older adults are still lacking in the resources, not only to get, but how to learn and use that technology. Next slide, please. So like Jenny mentioned in her introduction, the digital divide, according to the Oxford Dictionary, is the gap between those who have ready access to computers and the internet and those who do not. Next slide. So since we're here to talk about that digital divide, kind of like a tongue twister, I wanted to share how my role as a financial counselor for older adults has let me see firsthand just how this divide hinders their ability to break out of social isolation, especially during this pandemic. So I've seen them be taken advantage of both financially, emotionally. Therefore, it's so crucial to get our older adults access to computers. So here are some ways that people without that access to technology become socially isolated. So with the closure of senior centers, community centers, libraries, people did not get to attend social events, see their friends, but also many of these people relied on those places as their only source for access to computers and the internet. Once they closed, they had nothing. Also, with the closing of the libraries, it decreased their access to books, magazines, things that stimulate the brain and can help with dementia or diminished capacity. So I mentioned being taken advantage of financially and emotionally. Scammers and thieves have always targeted older adults, but especially during COVID-19, it was way more prevalent. If somebody lives alone and they're socially isolated, maybe their family has moved away, a spouse has passed, somebody might call them up on the phone and hear that loneliness in their voices and engage them into giving out, too much personal or financial information. They start oversharing. There's also romance or catfishing scams. Those are the ones that tug at you emotionally and financially. And those are geared towards seniors as well. And of course, all the computer scams that are out there. Also during the pandemic, people lost touch with, their family members and friends. And without computers, tablets, or even smartphones, they lack that personal connection that we all need as humans. And lastly, many seniors missed doctor appointments or just didn't go because they did not know how or have the means to do a virtual telehealth appointment. Next slide, please. So at the beginning of the pandemic and quarantine, ESAP started to have the conversation of how do we reach out to our older adult clients during this time, and how do we get our services to them that we are no longer able to do in person. So pre-pandemic, I'd go to senior centers, senior apartment buildings, libraries, and I'd present our senior financial empowerment workshops. We discussed topics like preventing financial exploitation and computer scams, estate planning, how to budget and save money, as well as accessing benefits and understanding credit and debt. But now that we could no longer meet in person, we immediately had to come up with an alternative. And that alternative was a virtual workshop. So we decided to do this to continue teaching and helping them to watch out for scams, make good financial decisions, and prepare for the future. The problem, though, that we ran into with these virtual workshops was that most older adults didn't have access to computers, tablets, or even the internet. And if they did have a computer, they were not very tech savvy, they weren't confident or very sure how to use or even access our classes. Next slide. So we met with Huntington Bank, we told them our dilemma, and they ended up giving us a very generous grant. And with that grant, we partnered with 2 other nonprofits. The first one is Digital C, and then also the Ashbury Senior Community Computer Center. And through this grant, Digital C is able to provide free internet connectivity for 1 year to our clients who participate in our virtual programs, as well as laptops with webcams for each participant. And then through the Ashbury Senior Community Computer Center, technology training is provided twice a week for 6 weeks for participants to gain the knowledge and confidence to use those laptops. So up on the screen is a picture, the far left, the tall guy on the left-hand side is our executive director, Mike Bilnitzer, and he's with our first group of participants who went through this program. And then in turn, by learning how to use the computers, they can then attend our financial workshops, and they can also participate in our match savings program that we call LEAP. It's our Learn and Earn account program. And it's where we match people up to $500 at the end of a year of savings. So it's such a win-win situation for these older adults. We're currently on our 4th cohort of participants, and it's going great. It's going really well. The feedback from the seniors is that they truly enjoy attending the classes, the computer classes, and that the instructors at Ashby are great at simplifying and explaining. They have lots of patience, whereas before they all felt really intimidated just by the thought of learning something new. Next slide, please. So not only can they use their laptops to be part of our financial education workshops, but they get to take them home at the end of the classes and keep them. And the benefits to having a computer for an older adult are so many. So a few examples up here on the screen is that it definitely fosters independence. So they can start paying their bills online, go online shopping, order prescriptions, go to virtual doctor appointments. So for seniors who don't drive or are disabled or homebound, it's such a great thing to have that independence and not have to rely on others for their needs. Connecting with family and friends is one of the best reasons for learning how to use technology. I'll tell you, most of my clients love to use Skype. They Skype their grandkids, FaceTime, or they go on social media, see all the pictures. You can just stay in touch with your loved ones. Next slide. So just the other day, I was visiting a senior apartment building, and I was talking with a group of ladies who were actually very tech savvy. They use their computers all the time during quarantine. And each one of them was telling me about all the free classes that they went to, that they did virtually, and all the different tours that they went on. So through the computer, they were able to take tours of famous museums. They went to the pyramids of Egypt, national parks, the Natural History Museum, one of them said they took a tour of. And one of them even took a tour of Alaska, and she made the funny joke of she didn't have to bundle up. So they all said that it really helped them through any of the loneliness or the isolation that they may have felt otherwise. Next slide. So I just want to thank you again for listening, and I guess we'll be taking questions at the end. So thank you.
Thank you, Rachel. Our next speaker this evening is Constance Hill Johnson, owner and managing director of Visiting Angels Living Assistance Services in Cleveland, Ohio. Visiting Angels is an in-home service provider assisting older adults to live as independently as possible by remaining safely in their own familiar home environment. Ms. Hill Johnson's expertise spans a wide array of organizational settings, including acute care hospitals, physician medical practices, and professional management service companies. Ms. Hill Johnson is a Benjamin Rose Institute on Aging board member and also serves on the board of directors of the Cleveland Foundation and Adults at Risk, a pillar of Lutheran Metropolitan Ministry. She is a member of the African American Outreach Committee of Hospice of the Western Reserve and is one of the architects of the Soul of Philanthropy Cleveland and Celebrate Those Who Give Back, Please join me in welcoming Connie Hill-Johnson.
Hello, everyone. I am tremendously excited to be here. Thank you so much to Benjamin Rose and the young professionals for even having the foresight to think of this topic and the impact of this digital divide on the largest growing population in the country right now. And as the owner of Visiting Angels, I see every day what this digital divide is, how it's affecting the lives of the seniors we serve. So it's a privilege to be here. First slide, please. So as we talk about social isolation and how appropriate to follow Rachel, because much of what she shared you might hear again in a different form. But really, as we are all listening to the news and reading the paper and perhaps even talking about those in our families and our communities, we're recognizing that this spreading social isolation is more and more becoming well documented. Even the Centers for Disease Control describes loneliness and social isolation as a serious public health concern. Nearly 1 in 4 adults, think about that, 1 in 4 adults aged 65 and over are considered socially isolated. And nearly 1 out of 3 adults, even over what we're now going to call the young age of 45, feel lonely. Social isolation, and many people and physicians are recognizing this, increases the chances of premature death and rivals the risk of smoking, obesity, and inactivity. I'm quite sure many of you all who are listening now and watching have read about, heard about, talked to others about what social isolation has done to our seniors who are in facilities and where family members couldn't come in, where they're talking to family members and loved ones through the window, where they're having very, very limited contact with anyone. Some of the facilities that I deal with, even those who are in assisted living, not nursing homes, assisted living, the food tray is dropped at the door and there's a knock on the door, and then the senior would have to come get their tray because in some facilities the staff aren't even allowed to enter. So think about that. Think about the fact that if you're 85 or 90 and you're in a home, in a senior apartment or in an assisted living, and your contact is so limited that the staff can't or aren't allowed to even bring your tray of food into you during mealtime. We are seeing that older adults are living longer. I have been in business almost 20 years, and I am amazed at the longevity of our seniors now. I serve many clients who are well into their 90s and some a little over 100, but more are likely to live alone and to be far less socially engaged than previous generations. I think what we're seeing now are adult children who don't live in the same city as their elders. Many seniors are in their same community that they lived in and raised their children in for many, many years, but their associates and their friends and their neighbors are dying sometimes before them, and so that adds to them being less socially engaged and being more isolated. Next slide. So when we talk about technology, and again, following behind Rachel, you might hear many older adults well-versed in technology, but as a group, they lag far behind the younger population. A very recent Pew study in 2018 found that only 73% of people over 65 use the internet. And that use is even more limited among those age 75 and up. Another Pew Research study in 2019 showed about 41% of people over 65 do not even have wireless broadband access in the home. So I'm going to pause here because I don't know how many of you all have really, again, been watching the local news here in Cleveland, as there's been a lot of discussion around the lack of broadband access in certain communities. We heard about it a lot when many of our children in various school systems had to go to remote learning. Well, think about the amount of seniors who live in some of those same communities who also don't have broadband access in their home. So that number works out to about 22 million people out of 56 million. Now, of course, many of those 22 million may have slower connections or can access the internet through their phones. But even if those physical barriers are removed, a lack of computer training can still be a barrier. So even in some of those communities where there may be a little bit of a broadband connection, it's extremely slow. And because many seniors don't know how to maneuver, whether they have a tablet, let alone a laptop, and God forbid they're trying to work on a smartphone, many of them are left at a loss. Next slide, please. So we talk about the solution to increasing technology use among older adults. It's going to require a lot of cooperation between internet service providers, tech companies, and those tech companies need to be sophisticated enough to design easy-to-use devices to offer senior discounts, which you see a lot in the education field. And we need more and more organizations that serve older people like Benjamin Rose and other similar organizations in the community. 3/4 of older adults over 65 said they needed someone to set up their electronic devices. Now, I'm going to digress here for a minute because I have on staff at Visiting Angels probably 10 to 15 staff, we call them caregivers, who are over 65. My oldest home health aide is in her early 80s. And I know when we went to direct deposit years ago, where everyone had to access their paycheck stub online, many of my older workers said, Connie, I don't know how to do that. I'm going to have to get someone to help me. I'm going to have to get my grandkids. First, I have to go buy a laptop or an iPad. The other thing that was amazingly interesting to me also was we went to a texting practice at my company. And again, many of my older workers were not savvy even about texting. Of course, I'm sure you can appreciate many of them still had old flip phones. So I see it even with those who are in the workplace. So imagine what it's like for those who are isolated and in their homes, and there's not anyone around to not only provide them with the needed technology, but to be patient enough to teach them how to use it. 1/3 of the individuals I was talking about also said that they weren't even confident at all in their ability to use electronics. And I've heard that amongst seniors too. It's let me keep my landline phone and let me keep writing a check and reading the newspaper, and I don't want to deal with all the gadgets because they're concerned about their aging and they're concerned that they don't have someone who is around them consistently enough to help them maneuver and learn how to use it proficiently. Next slide, please. So one of the things that we are seeing a lot, particularly in the field that I'm in, and for those of us who work with seniors or interact with seniors, we'd be hard-pressed to not recognize that adult children do not live in the same community or the same city or state that their parents live in. And I have seen over many, many years an increase in what we call long-distance caregiving. So again, many of the seniors that I deal with every day, that I work with, they don't have any children in Cleveland at all. The adult children have gone off to college. They've secured career opportunities in other cities. They've married. Their jobs take them across the country, and they're not returning to Cleveland. But yet their parents still live here. They don't want to leave Cleveland, but they're aging and need some assistance. And so we're seeing more and more companies recognizing that technology needs to be developed to keep long-distance caregivers, whether they're the children or the grandchildren, in touch with their aging loved ones here in the city of Cleveland specifically. So a couple of things we're seeing. Web-enabled home sensor systems. And it's all about this new smart home technology. Many of you might already be able to, I know my husband can, he can set the thermometer from his smartphone. He can start his car from a smartphone. The lights can come on and off from your smartphone. And so we're starting to see a lot of that with seniors, where motion and door sensors will let someone in California know whether their loved one is moving about or opening the doors. Family members can be alerted by an alarm, if you will, if a senior opens the refrigerator or uses the microwave, because one of the things that we as a nation are concerned about is food insecurity. And we see that a lot with seniors, and again, those who are socially isolated. The next one is what we all know is I've fallen and I can't get up. The emergency response button, or what is known as personal emergency response systems. So they either come with a belt clip, many seniors wear them as a watch, or a pendant around their neck that they can slide under their blouse or their turtleneck sweater. It always amazes me that what we see with seniors today is I have many of my seniors saying, well, I don't want to wear one of those because I don't want anyone to know that I'm old or to think I'm old. And I have to convince them that this is for your safety. You live alone. In the event that you fall and you can't get to the telephone, being able to push your emergency response button will alert the appropriate people to come to your aid. Many of them have GPS trackers. So if a senior is out taking a walk and they fall in the park, they can hit the button, hopefully, and the monitoring station will be able to identify exactly where they are. So we're watching technology be in place and be better developed to serve seniors who are isolated, and to serve those seniors who may even choose to live independently and don't have family members or caregivers around on a regular basis to check on them. Next slide, please. Medication management is a big thing. A lot of hospitalizations for seniors these days is because they forget to take their pills. And hospitals are really, really looking at how do we keep seniors healthy and at home, recognizing that a lot of the readmissions to hospitals is because of missed medication. So again, smartphone medication reminder applications, they really act like an alarm to remind the senior to take their pills. The long distance caregiver, again, can have the same system on their phone. And when the alarm goes off, if nothing else, they can pick up the phone and call their mom or their dad and say, it's 6 o'clock, it's time to take your pills. And that gives them, again, another touch point, another opportunity to converse with them. Or if they have that smartphone, to do FaceTime with them. Another option is countertop automated medication systems. I particularly love these, and I've seen them in several homes. The pills are loaded by a trusted family member or friend, and family members can record their voices. So if it were my mom and I didn't live in town, I could record my voice and say, hey, Mom, it's Connie. Hope you're doing well. It's 3 o'clock, and your pills are about to spin around and drop out in a little dispenser, and I need to make sure you take them. So we're seeing more and more of that, and technology allowing these systems to be more personalized so that these seniors can actually hear the voices of a trusted family member or friend, and not that recorded voice that we all hear, on our GPS in our car. And the alert will also go off. It will go off and continue to buzz until the senior has taken their medicine. And sometimes the alert will, after a certain amount of time, go off for a family member or someone else, indicating that their medication has not been taken. So again, we see technology playing a big part in long-distance caregiving. Next slide, please. So I think, and again, this is so exciting for me as I am sharing with the audience and the young professionals. One of the things that I've been discovering is there are some organizations around the country where young people and teenagers have galvanized and come together and formed organizations where they're going out in the community and literally training seniors and working with seniors and getting them more proficient on using technology in their homes so that they can stay connected to the community and their family and not feel as socially isolated. So one of them I discovered was Can Do Tech. and it's a tech company that provides tech support and training to help older adults feel more comfortable with phones and computers and tablets and even more sophisticated technology. So make sure you check that out. The other one is only in New Mexico, but wouldn't it be great if folks here in Ohio or Cleveland did a spin on this? And it's called Teen Wars, and they're tech-savvy teens who are empowering seniors, again, by spending time with them and getting them trained and proficient on using, whether, again, it's a laptop, iPad, knowing how to send an email, or even use their smartphone. Third organization you might want to check out is called Cyber Seniors. Website is cyberseniors.org, and they provide free technology support and training to seniors. So make sure you go to that website and learn a little bit more about them. And the last one I thought was quite interesting is called getsetup.io. I'm continuing to learn that there are many endings to a URL, and everything is not .com and .org. But this is a site that offers a variety of technology tutorials specifically for seniors, from courses on how to use social media sites to virtually refilling prescriptions or ordering groceries. All of the classes are even taught by older adults. So it's a really good place for active older adults to learn, connect, and share with their peers in small, intimate classes. So I think as we look at technology for the homebound senior, technology for those who are socially isolated, or even technology for the senior who perhaps is still active, we're seeing that companies and development folks are moving in the direction, recognizing that our population is aging, and that I don't know the number, but every day a huge number, thousands and thousands of people turn 65 every day. So the U.S. companies, technology, and our society have got to turn our focus and pivot to what we can and should do to make sure that our seniors stay connected to families, the community, and to the society at large. So I thank you for the time and look forward to the Q&A as we approach the end of this time together. Thank you.
Thank you, Connie. Our final speaker this evening is Dr. Jennifer Drost. Dr. Drost serves as the home-based primary care medical director for Summa Health and routinely sees homebound, frail, older adults and their families. Throughout her practice, she focuses on ensuring patient-centered care while optimizing the interprofessional team. Dr. Drost is also the Geriatric Fellowship Program Director at Summa Health and the Co-Project Director for the NeoMed Geriatric Workforce Enhancement Program, funded by the Health Resources and Services Administration, focused on interprofessional and multidisciplinary team practice in geriatric education and primary care. Please join me in welcoming Dr. Jennifer Drost.
All right, good evening. Thank you all for attending here. I know I've been learning an awful lot and really appreciate all of the resources that have already been presented. So taking just a little bit of a change in focus and kind of really looking at how all of this applies to medical care these days and where that digital divide really does affect our most vulnerable older adults. So next slide. So prior to COVID, telemedicine, telehealth was really pretty limited by a lot of specific requirements. And with the pandemic, the government made a lot of those requirements go away, initially temporarily while we were just in that state of emergency. But there's a lot of talk that those requirements as a whole aren't going to come back, and that telemedicine and telehealth is really something that's revolutionized our ability to care for populations of people in ways that we didn't have before. So working on developing a process and engaging particularly older adults, especially vulnerable older adults, on these services is really important. So when COVID hit, of course, right, shut down everywhere. And the healthcare was no different. And from, I think, March 20th until about May 20th, we were actually kind of forbidden to do routine visits, in the office or at home. We could do them as one-offs, validating with a whole lot of other questions, but the focus really did switch to doing them via remotely via telehealth options. Back slide still. However, we still recognize that, or through that we recognize, right, that people still needed to be seen. They needed to be seen in order to assess their diabetes or their blood pressure control. They needed to be seen, and I'm putting kind of seen in quotes, in order to adjust medications or to refill medications or to be able to talk with their healthcare team about new symptoms that were arising. Should they be worried about this? Is this COVID? All of those things really highlighted the importance of still maintaining that communication with the healthcare team. And so that switched to telemedicine. But as we'll talk, and as you've already seen, there are many reasons why this approach really did miss some of our most vulnerable older adults. Now, as I said, I'm primarily a house calls doc, so I see older adults who are largely homebound. It's a lot of difficulty for them to get out of the house. The majority of these people have multiple chronic illnesses, and they have caregiving needs, and so family and friends are providing that care. And so we had to switch and navigate how we work with not only that individual, but also their caregiver to help to facilitate this. One thing I would note in this process, and even though we've had struggles with many of our patients, particularly the two-way video conferencing piece, folks are really happy to talk with us on the phone, but to be able to do a bit of a physical exam, eyes, laying eyes on somebody can provide so much information. That was really a challenge. But one of the biggest benefits that I saw was for a lot of our patients who have difficulty or who aren't able to leave the home to go to their specialty appointments, because not only is primary care doing this, but your cardiologist and your pulmonologist and your dermatologist, right? All of those folks started doing telehealth visits as well. And so they were actually able to connect with a cardiologist or connect with their lung doctor where they weren't able to do that as effectively or efficiently before. So that really has been a perk in there. Next slide. We know that telehealth interventions reduce chronic illness risk factors, improve medication adherence, improve those clinically monitoring factors like blood pressure control and diabetes control, dietary options. There have been increasing studies on using telemedicine in mental health and providing counseling and support for depression and anxiety, as well as extending the reach of sometimes limited resources. The remote patient monitoring, and many of us may be doing this and not even knowing it. When you're checking your blood sugar and you're calling in your blood sugars to the office, that is a form of remote patient monitoring. And some of the newer devices, like the continuous glucose monitors that are worn as a patch, those blood sugar readings can actually be downloaded electronically and sent through the internet to your doctor's office. So not only are you not having to prick your fingers 3 times a day, which is a plus in and of itself, but there is that potential for some real-time transmission of information if people have access to the internet. We can use it to augment in-person visits. So we still say we need to see you a couple times a year. I need to be able to do a complete physical exam, but those touch points in between, we can enhance that communication, enhance the education that we're able to provide. We can support home health. So there are lots of visits that I did in conjunction with a home health nurse. So the home health nurses were still going into the home, or the physical therapist was still making some home visits, and being able to coordinate that visit to do a wound assessment or to check blood pressures and those sorts of things. And then really to be that ongoing support. We hear it over and over again of the difficulty of getting people out of the home in order to make visits. And so being able to do those visits in home can definitely be helpful. Next slide. But as we've heard, there are so many people, and particularly the oldest old, so those over 85, but certainly the numbers start to drop off after 75, like we've seen. Those with chronic illnesses, those with hearing or vision impairment, people with dementia or cognitive impairment or other behavioral health concerns might be a challenge in order to get them to effectively use the tools. And then the access issues, which we already heard about. Do they have the devices? Do they have high-speed internet or stable Wi-Fi or a smartphone connection? Do they have the knowledge and operability in order to log into a unique platform in order to do a telehealth visit? Next slide. So we've seen, that this isn't a blatant statement, right? There are a lot of older adults, particularly, those baby boomers that are turning 65, but even older adults. I've had folks in their 90s who are utilizing FaceTime, as we heard. So they do have access. Many people do have access. Many people do have the knowledge and the interest in order to become comfortable using these platforms. But they've linked, healthcare spending. 75% of this is due to chronic illnesses, and 1 in 5 households will care for a person, an older person or disabled person who requires assistance. So we can see how those numbers are increasing too, and how using that technology perhaps lets them stay at home a little bit longer. Next slide. So what can we do? And number one, but trying to facilitate some of these visits if we can to increase the comfort. So I wanted to talk through just a few ways to try to increase the usability of these platforms. So one, practice, right? So this is our first time trying to set up the 5 minutes before that appointment time is. So you want to make sure that you're confirming with the office. You want to make sure everybody has their glasses, they have their hearing aids or their headset to try and block out noise. Using video can be very important, though adds to that complication. We've all seen how when we put those masks on, our ability to understand people plummets, whether that's at the grocery store or wherever. It is so much harder to understand people when we don't have the visual cues from the mouth. We want to ensure the light is bright, but not too bright, right? And trying to avoid bright lights behind people so that they can see better, and then really position the camera so that it's on your face. Ensure that people can hear and see each other, and be alert to cues that maybe that the older adult isn't understanding, isn't following the conversation, just kind of nodding along. But you might see those types of things. Next slide. When you're actually doing the visit, both parties focusing on speaking slowly and speaking clearly, not necessarily speaking more loudly. As we speak more loudly, our voice actually goes up, our pitch goes up, and we lose our higher pitch hearing ability as we get older. That's just one of the normal things that occur. And this goes whether you're in person or via technology. So the goal really is to speak slightly more slowly, but really to enunciate the difference between the words in order to try and facilitate hearing. Repeat, rephrase those questions. If you are helping to facilitate, repeating or rephrasing it for the older person to better understand, and then to ask for clarification for questions that are, kind of being that, that reminder. Hey, Mom, didn't you want to ask the doctor about this or about that? Those can all be helpful things. Next slide. And then ask to do a run through, right? So, one of the goals, hopefully, of being a caregiver is that we're really trying to empower you to be advocates for your loved ones. So ask to do a run through, ask for prep, get comfortable with one platform. And I have this headline actually from USA Today from just a few months ago Zoom has a lot of usability, and right now it's still an acceptable, from the government standpoint, platform in order to do these visits. So play with Zoom. Use Zoom to call family, to call friends. Get comfortable with it. Utilize the closed captioning option in order to help with some of that communication. And then ask if that can be the platform for the individual. A lot of health institutions are trying to use ones that are embedded in their EMR. Some people have had success. Personally, I've not even actually had success in being able to navigate that quite yet. So, being flexible is important. Prepping for the visit, creating a list. This is like any medical visit, right? So we want to come prepared. You don't want to be rushing everything for the end, because then everybody gets flustered and nervous and questions get left on the table there. Trying to eliminate the background distractions, trying to sit in a well-lit area, asking to repeat, asking for more time. And then kind of along with the getting comfortable, I love that idea that Connie showed her, the one group, the getsetup.io. I love that it is guided by other seniors who are participating and teaching it. I think there's still a lot of hesitancy within some populations of older adults, not trusting it, right? This isn't secure. They don't want to sign up for their MyChart applications, even though maybe they are using the internet or using email, because of fears of the security of it. So engaging with other adults can really, I think, help to minimize some of those worries and those fears as well. Next slide. And then similarly, this is actually right out of Neomed, so here in Northeast Ohio. And like a lot of younger adults, as Connie was pointing out, when COVID hit, the medical students, particularly those in their clinical years, so their third and fourth years, were kind of all brought back. They kicked the medical students out of the hospital too at the start of COVID, and they really were struggling. They wanted to be a part of the solution to the problems that they were seeing or they were concerned about. And so they've created this Connect NEO, and it is all telephonic. And it says tell your geriatrician, so they're working with our office, but the number and the contact information is there. And their goal is to do kind of help people set up their accounts and to provide some navigation for the platforms. They do have some additional handouts to walk through, like getting the Zoom set up, getting into MyChart. But they also have support for using your medical devices. So people who are having trouble using their blood pressure cuff or using their glucometer to check their blood sugars, they'll provide support for those things as well. So that could be potentially another local resource. So we all know, and we've heard from others today too, how technology has been a struggle. And I think we've seen in the news, particularly as we started rolling out the COVID vaccinations, how this population of older adults who don't have connection, we really need to focus and think through how we've worked to facilitate that, because they are getting left out, and they are some of the people who are most likely to benefit from these resources. So hopefully had some hints on how we can work to facilitate that for them.
Thank you so much, Dr. Drost, and thank you so much to all of our speakers. We now are going to begin the question and answer portion of our webinar, and I'm going to invite all of our speakers to unmute themselves and to come on the camera if they wish. And if you have a question for our speakers, please enter those in the questions box now if you have not done so already. So our first question is from an attendee who asks, most of us agree that social isolation is bad, but we're running into denial that someone is socially isolated. So how do we overcome this and help them to see that programming to address social isolation is a benefit to them? And I welcome any of our speakers to answer this question.
This is Connie. I'll start, and you can see I'm on a good old-fashioned landline phone. But I think it depends on the approach. You have to first determine, is this senior homebound? And the physician can more clearly define what homebound is, but is this someone who cannot come out? Therefore, you need to bring programming and resources in. I think that's what I see with, again, some of the seniors that I serve. Some cannot come out. So we have to be more tech savvy and innovative about what we bring to them to help them feel more engaged. Now, for the senior who can leave their home, that's a whole different challenge. But we're in COVID right now, so trying to convince my seniors still that it's okay. We're going to mask up. We're going to socially distance. We're going to stay outside. It's still sometimes difficult, but it's got to be someone that they trust, who they have a relationship with. Things are so much easier when you have a relationship with someone and they know you're a trusted friend or family member or colleague.
Thank you, Connie. Do any of our other speakers want to add anything to that?
Yeah, I was going to say, well, I agree with Connie about having some trusted and familiar people. But for example, we have some apartment buildings that are interested in using the services of the computer classes. But a lot of those seniors don't have transportation. It's a really big issue. So we are trying to get the instructors to come to them. So that's one of the ways that we've been working on this. But yeah, transportation is definitely an issue.
Thank you. Someone else asked, we've set up around 100 seniors with tablets and are training them to use the apps. Is there a universal app to access telehealth? I think this question is for you, Jen.
No, there's not. I think I personally have 3 different ones on my phone. And that's not including Zoom and WebEx and FaceTime that are also all available. So unfortunately, there's not, but there still is a lot of flexibility, which in the platforms, obviously, HIPAA and privacy rules and regulations have been a limiting factor in the past. And right now, a lot of those restrictions have been waived. So still advocating, again, for picking one. FaceTime, Zoom might be easier ones than others. And trying to advocate for one that you are comfortable with. But every EMR has their own platform. There's Doximity and, yeah, all kinds of ones.
Thank you. The next person asks, what are some examples of solutions for older adults experiencing the financial barriers of the digital divide?
Yeah, that's a good question. So as far as I'm wondering if they're asking as far as the financial barrier to get the technology, or the financial piece of, maybe doing online banking, things like that. Well, there are other places out there, as we've all mentioned, that do have free access to computers, to the internet, like the libraries. I just have a lot of people that go there to really take advantage of the fact that they can use their computers. Some libraries even rent tablets. As far as senior centers, they're not really open right now yet, but they also offer computer access.
Thank you. There's a follow-up question, Jen, to the question that was asked about the universal app to access telehealth. Someone asked, is there a protocol practiced by all health centers? For example, do they normally get a link to sign in?
Again, not necessarily. A lot, particularly those who have Epic, which is pretty common around here, they are utilizing access through their MyChart app. So you log into your MyChart account either on your phone or on your computer, and then from there you can click into your appointment. Some are using other applications. I know we were using like Doximity to do some, Doxy.me, in which case a link does need to be sent. A lot of those can be sent directly to a phone number, so it's directly to texted to them, and it's kind of a one-click you're in, which actually seems to be much more user-friendly to me than the My Chart. But yeah, because there's so many different applications, there's multiple ways to access it.
Thank you. Connie, this question is for you. Someone asked, how are your staff caregivers creating the link between family members and the older adult clients during the time of social distancing, but also for those family members that live out of state or out of town?
Great question. A lot of FaceTime. And some of my aides sometimes will use their own phone if the senior doesn't have a smartphone. Initially, I didn't know how comfortable I was about that with access of family members out of state having my employees' personal phones, but we're living in very difficult times now with the pandemic. So you have to, as an employer, you have to bend some rules sometimes. But that's been one way. Another way is, and we're starting to see some companies pilot different types of technology. The system we're using now has an added portal that is still being developed, but what it will lead to is, again, the daughter or the son in DC will be able to log on, read what occurred that day with their loved one, and then there will be almost like a video webcam where they can check in, or the family member can log on while my worker is there, and they'll have an opportunity to have live interaction with their loved one. So we're starting again to see that happen. I have seen my staff take time just because they're caring folks with the senior with their tablet, or if they happen to have an old computer. I haven't run into too many seniors who have the latest. I'm not sure I have the latest up-to-date laptop, but where they're taking some time showing them how to do some online banking. I was glad Rachel, because some of my seniors are a little tech savvy, and they're doing online banking and doing bill pay, and checking their credit card statements online. So we're starting to see it inch more and more into homes. And keep in mind, many of our seniors, their adult children are pretty tech savvy, and so they're more effective gently on mom or dad, particularly if they want to maintain contact. And they're saying to mom and dad, if you want to stay in your home and I want to keep you in your home, I have to be able to connect with you. So you're going to have to learn this, or I need you to learn this, or we're going to have this discussion about maybe you can't stay in your home. And so that's always a nice convincing factor for mom or dad is I need you to use this phone or this iPad to stay in contact with you, or we may have to talk about you living somewhere else.
So, there certainly is a financial piece to all of these devices. But I think I might add it to my list. I tell families often, I presume maybe ineffectively, right, that by the time people are 80s and 90s, like buying them Christmas gifts can be a challenge, right, or holiday gifts or birthday gifts, or the special something. So for a long time I said, buy them grab bars, right, like get those installed. That'll be a perfect birthday gift. Happy 85, right? But adding in devices now might be a good idea for some families. And I've seen a lot that have done Alexas or Google whatevers and these sorts of things. And they just put them there and they can sign in and just look at mom, and if mom's sleeping, they'll sign back out, but they've been able to check, do that visual check-in. And patients actually, or my patients, they all seem to, they really seem to respond well to that face-to-face once they get used to it.
Well, we are able to now close out our program hearing from 3 experts on the digital divide, and we thank you so much for your time and your commitment to this topic. And I want to thank all of you for joining us and for your engagement in this discussion. We really appreciated all of the questions that you submitted. So we hope that you will stay tuned for more programming from the Benjamin Rose Young Professional Council. More information can be found at our website address, www.benrose.org/YPC. Before we conclude, we did want to invite you to save the date for some upcoming events listed on the screen. Information and registration for all of these events can be found on our website. Thank you again to all of our speakers and to all of you, and I hope you have a great rest of your evening. Take care, everyone.
Bye-bye. Thank you.
Thank you. Bye.